Welcome back to the Equine Anatomy lectures. Today we'll start the last part of this discussion, and that is the equine hind limb. Before, however, I start doing that, I would like to remind you of the email address that's shown on this slide. If you have any questions or concerns, please don't hesitate to write, and I'll be more than happy to explain anything that you need. Okay, let's start with outlining what the talk is going to be about. So this is basically the roadmap for this discussion. First, we'll talk about the different divisions of the hind limb, joints, muscles, nerves, and then we'll talk about each of the specific joints, stifle, hip, stifle, hock, and we'll stop at the hock. We will not discuss the digit because we've talked about it in the forelimb. It's the same as the forelimb, basically the fetlock joint, pastern joint, and coppin joint. They're the same. So we'll talk about the divisions, and then we'll talk about the joints and muscles and nerves, and then we'll talk about each of the joints specifically, and the passive stay apparatus of the hind limb, just like what we did with the forelimb. This is a picture that shows the fetlock, pastern, and coffin joints in the metacarpal area, and the same thing in the hind limb, except that we don't call these bones metacarpus bone 3, metacarpus bone 4, and from the medial side metacarpus bone 2. We call them metatarsus. Metatarsus in the hind limb. Metatarsus. So metatarsal bone 2, metatarsal bone 3, which is the same, cannon bone, and then metatarsal bone 4. 2 and 4 are the splints, exactly the same. And this is the proximal sesamoid bones, and here is the distal sesamoid bone or the navicular bone, exactly identical to the forelimb. There is nothing different whatsoever. As I mentioned during the lameness evaluation in the forelimb, I mentioned the hoof angle. The hoof angle here, this hoof angle here with the ground, between the ground and the hoof, is about 45 degrees in the forelimb. In the hind limb, I mentioned that before, it's about 48, and sometimes it can reach up to 52, depending on the breed and also on the job that the horse performs. Okay, so the first 3 joints are the different joints. Then the joints of the first 3 joints of the hind limb are the ones that are different than the forelimb. The remaining joints are identical to the forelimb, basically. So the only difference is the first 3: hip, stifle, and hock. In the hind limb, there are 6 different regions also. In the hind limb of the horse, there are 6 different regions: the thigh region, the leg or the crus region, the tarsus or the hock region, the metatarsus, the fetlock, and the digit. So 6 different regions in the hind limb. They are the thigh, the leg or the crus, the hock or the tarsus, the metatarsus, the fetlock, and the digits. And in these 6 regions, we have 6 different joints. In the 6 regions of the hind limb, we have 6 different joints. These joints are the hip joint, an articulation between the head of the femur and the acetabulum or the acetabular cup. Hip joint, an articulation between the head of the femur and the acetabulum. The stifle joint consists of 2 distinct joints. The first and the large one is the tibio-femoral joint. Femoral tibial joint. The second is the femoropatellary joint. Both of them are referred to as the stifle joint. So the stifle joint consists of 2 distinct joints. The large one is the femoral-tibial joint. Femoral-tibial joint. The second one is the femoropatellary joint. Femoropatellary joint. The third joint is the hock joint. The hock joint. And the hock joint consists of 4 distinct joints. 4 distinct joints. The first one is the tibio-tarsal joint. Tibio-tarsal joint. The second joint is the proximal intertarsal joint. Proximal intertarsal joint. The third one is distal intertarsal joint. Distal intertarsal joint. And the fourth one is the tarso-metatarsal joint. Tarso-metatarsal joint. The 4 joints of the hock are tibio-tarsal, or also known as tarsocrural joint. The tarsocrural joint, an articulation between the distal end of the tibia and the talus and the calcaneus. The first row of tarsal bones. The second joint is the proximal intertarsal joint. Proximal intertarsal joint. And it's an articulation between the proximal intertarsal joint is an articulation between the talus and the calcaneus and the second row of tarsal bones. The second row of tarsal bones, the central and the fourth. Central and fourth tarsal bones. The third joint is the distal intertarsal joint. Distal intertarsal joint, and the distal intertarsal joint is an articulation between the central tarsal bone and the distal row of tarsal bones, namely the fused 1 and 2 tarsal bones and the third and fourth tarsal bones. The last joint in the hock is the tarso-metatarsal joint, and this tarso-metatarsal joint is an articulation between the distal row of tarsal bones, namely 2, 3, and 4, and metatarsal bones 2, 3, and 4, the two splints and the cannon. The 4 joints are called the hock joint. So the hock joint consists of 4 distinct joints. The remaining 3 joints, fetlock, pastern, and coffin, are exactly identical to those in the forelimb. Articulation between the distal end of the cannon, the proximal sesamoid bones, and the long pastern bone, or the first phalanx, that's the fetlock joint. The pastern joint is an articulation between P1 and P2, or the long and the short pastern bones. And the third one is the coffin joint, which is an articulation between the short pastern bone, or P2, the distal sesamoid bone, or the navicular bone, and the coffin bone, or P3, or the third phalanx. So again, 6 different regions in the hind limb contains 6 different joints: hip, stifle, hock, fetlock, pastern, and coffin. When we remove the skin from the hind limb, we will see a number of muscles. Semi-membranous, semi-tendinous, gluteus, biceps, femoris of course, tensor, fascia lata, vastus lateralis, semimemb and semitend, gluteus, biceps, tensor, and vastus lateralis. The semimemb and the semitend are used frequently for intramuscular injections in horses. Similar to the muscle in the neck, sometimes we utilize the semimemb and the semitends to give intramuscular injections in horses. Now, when you remove the gluteus superficius, which is the superficial muscle heel, when you remove it, the large gluteus medius appear. Now, this is a very important muscle because at the level of the greater trochanter, you have a bursa. A space that contains synovial fluid to reduce friction. This bursa can be infected sometimes, and the disease is called bursitis, trochanteric bursitis. Trochanteric bursitis needs to be drained and taken care of. Let's take a look at these muscles. So, the semimembranosus and the semitendinosus muscles, again, they are used pretty frequently for intramuscular injections in horses. We have the gracilis. We have the gluteus medius that we removed it and it has the trochanteric bursa. The superficial gluteal muscle that we removed, the tensor fasciolata that we've talked about. And of course you have the long and the deep and the superficial digital flexor tendons. Now, the semitend extends the hip joint, extends the hip joint. So both muscles extend the hip joint. The biceps extends and abducts the limb. Extends and abducts the limb. The gluteal, both superficial and medius, extends the hip. Gluteal deep, or the deep one, abducts the limb. Quadriceps extensor to the stifle. Extensor to the stifle. Gracilis adductor to the limb. You can see here that all of the muscles that we've mentioned are extensor. Extensor. Now, when we lose innervation to these muscles, we will lose the extension ability, either for the hip or for the limb. If we lose innervation to these muscles, we will lose the ability for extension of these joints and for the limb in general. So, the first nerve, when we take the large gluteal muscle away, is going to be the sciatic nerve. The sciatic nerve. I will talk about each of the nerves in the next slide, but this is just a summary of what are the nerves are. We have muscular branches of the sciatic nerve. We have the tibial nerve. We have the common peroneal nerve. And from the medial aspect, we have the femoral nerve. So we have the sciatic nerve, tibial nerve, and common peroneal. And then from the medial aspect, we have the femoral nerve. Now, so the innervation of the hind limb is basically done by three major nerves: the sciatic nerve, the femoral nerve, and the obturator nerve. The sciatic nerve, which is a motor nerve for the semimembrane and the semitendon biceps, branches into two nerves, a tibial and a fibular. A tibial and a fibular, or peroneal. Now, the tibial is motor for the extensors of the hock, whereas the peroneal or the fibular is motor for the flexors of the hock. Also, the tibial is sensory for the caudal aspect of the limb, whereas the fibular or peroneal is sensory to the cranial aspect of the hind limb. So, the tibial and the fibular complement each other. The motor part of the tibial supplies the extensors of the hock, whereas the motor portion of the fibular supplies the flexors of the hock. and then the sensory part of the tibial supplies the caudal aspect of the limb, whereas the sensory portion of the fibular or the peroneal supplies the cranial or the lateral aspect of the limb. Now, the femoral is motor for the quadriceps and sensory to the medial aspect of the limb. It comes on the medial aspect of the limb. So when you have femoral nerve paralysis, the quadriceps is atrophied, and then you will have, instead of extension of the stifle, you will have flexion of the stifle. Now, with the sciatic nerve, again, you have motor for the extensors of the hug when you have and motor to the flexors of the hug. So when you have paralysis of this, you have the semimem and the semitend will be paralyzed, will be atrophied, and then you will lose this extensor to the hug and flexion to the limb. So the obturator nerve at the end is the one that happens usually when you have a problem during birth, trauma to the nerve, because this nerve is basically lying on the medial aspect of the birth canal, and so any trauma to this nerve will lose the adductor functionality of the limb. So the problem is going to be abduction instead of the obturator doing adductor to the limbs, so they or the nerve keep the two hind legs together. One of them, based on the injury, it will be adducted. It will be separated, abducted from the other leg. So this is a sciatic nerve paralysis, and you can see here, this is a chronic injury. You can see that the semimem and the semitend are pretty atrophied. Also, you can see a touch-toe lameness in the horse. This is a femoral nerve paralysis. Femoral nerve paralysis. Femoral nerve paralysis. The quadriceps is going to be atrophied. And instead of the extension of the stifle is what? It's flexed. The stifle is flexed at this point. Very important. The obturator nerve comes on the medial aspects of the birth canal in mares, and usually what happens is that you have an injury to this nerve during parturition, and what happened is that because the nerve adducts the limbs, now the limb is abducted, and it usually happens unilaterally and not bilaterally. Unilaterally and not bilaterally. Now, this is the injury to the obturator nerve, and you can see that the pony is unable to adduct the limb. This is the pelvic region in the horse. And the very first thing that we realize is that the ilium is attached to the vertebral column here by a ligament that we will see later. It's called the sacroiliac ligament. So the ilium of the pelvis is attached to the vertebral column by the sacroiliac ligament. Now, this is where the sacroiliac ligament is going to be located to attach the ilium with the vertebral column. This is basically a better or a more clearer picture of the location of this joint and this ligament. Now, sometimes due to trauma falling on the back, similar to this case here, the sacroiliac ligament ruptures. The sacroiliac ligament ruptures. And so the side of the hip that has this rupture will be elevated compared to the normal or the healthy side. So the side that has the rupture will be elevated. This case is called Hunter's bump. This is a case of Hunter's bump. You can see that this side is more elevated than this side. The right side is more elevated than the left side. This is a classic case of Hunter's bump. And when the examiner presses on the lesion, the horse arches its back due to pain because the articulation here is lost. The rupture took place. The rupture of the sacroiliac ligament took place. This is a classical case of Hunter's bump, also known as sacroiliac subluxation. After this, we will have the hip joint. This is the hip joint, an articulation between the acetabulum and the acetabulum and the head of the femur. Next lecture, I will start by talking about this joint and what stabilizes it and everything else related to this joint and the others. Until next time.